right, so my report is going to be on botulism. Once again, let's get started here. All right, so botulism. Botulism is an illness that stems from Clostridium botulinum, which is pictured on the screen. It's a gram-negative spore-forming anaerobic bacteria, which produces the neurotoxin botulinum. So it's not the actual bacteria that causes the problem, but the neurotoxin that's produced, byproduct of the bacteria. So Clostridium botulinum is a bacteria designed to survive most environments. It does this by utilizing its spores as a protective barrier to endure extreme conditions, which is why you can find it, from the city to the forest and wetlands, just about anywhere. You can find this bacteria. With regards to the spores that it creates to endure these extreme conditions, the byproduct of the spores is what leads to the neurotoxin. With regards to the neurotoxin, certain conditions have to be met, and those conditions would be low oxygen to no oxygen, low acid, low sugar levels, low sodium, and a certain temperature range and a certain amount of water as well. Given all these factors into play, would then increase the chances of the spores becoming or turning into a neurotoxin. Now, on this slide, we're basically covering symptoms of botulism. Again, this is stemming from the neurotoxin effect. So the way it works is the neurotoxin attacks the body's nerves. It does this by preventing the release of acetylcholine from the axon endings at the neuromuscular junction, which prevents muscle stimulation, eventually leading to flaccid paralysis. Some of the earlier symptoms are mentioned here, from dry mouth to nausea, vomiting, and as these symptoms progress, anything related, which is most of the body, to muscle or muscle movement, you start to see symptoms of drooping eyelids, from the tiniest to the biggest muscles, difficulty swallowing, trouble breathing due to the diaphragm not being able to contract, and eventually paralysis. Now, onto botulism types. There are 5 different types of botulism. We have foodborne botulism, which is basically canned goods. Infant botulism, which isn't fully understood as to how it appears in infants in the first place. One of the methods, but not necessarily the only one, that they have been able to determine is honey. So feeding infants honey basically sets up a scenario where you have those contributing factors that can turn the bacteria into a neurotoxin. The third type would be iatrogenic. So basically what that means is just an illness stemming from a medical procedure. In this case, putting in the Clostridium botulinum bacteria into medication for the purposes of Botox or any other medical means. Intestinal botulism is also unclear as to how that happens. It gets into the intestinal tract, and given the factors mentioned earlier, the low sodium and acid levels along with the water makes a perfect environment for the neurotoxin. And last on this list would be wound botulism. Once again, all those factors come into play, and that's just simply not properly addressing or taking care of a wound. The Center for Disease Control reports in the United States an average of 110 cases of botulism is reported annually. So in the grand scheme of things, it's not that often. But when these cases do come up, they can be they are pretty deadly. A treatment for botulism. There is a treatment. There is an antitoxin. It is readily available, and it is a one-time use. Of course, depending on some of the symptoms or the severity of the symptoms, you may find yourself staying in the hospital for quite a few days. But aside from that, the antitoxin is available. It wouldn't be an ongoing thing, so it would just be a matter of staying away from the bacteria or the neurotoxin of the bacteria. But aside from that, a hospital stay would be warranted depending on the severity of the symptoms. And that concludes my presentation.
If it's pretty bad, you just